Good morning, everybody. I am Gabrielle Bullock, chair of this year's Charrette Committee, principal and director of global diversity with Perkins & and I'm also a member of the USC Architectural Guild Board of Directors. So welcome to the challenge reveal of the 11th annual USC Architectural Guild Design Charrette. The Charrette is a rigorous jury competition. It's a collaborative planning process that harnesses your talents and your energies to create and support a master idea. A plan that represents transformative community change. And past competitions have tackled issues like homelessness, wildfires, the Olympics, just to name a few, often addressing current challenges of urbanization. Serving on the Charrette Committee with me are leaders of the built environment representing large and small firms, including USC architecture alumni and non-alumni. I want to thank each and every one of the committee members, who most are on the call today, for volunteering their time and expertise in designing this year's challenge. And a special thanks to Corrigan and alumnus Anthony Wang for partially sponsoring this year's Charrette. And please note, the challenge reveal this morning will be followed by a very important and special presentation. Please hold your questions about the challenge until after the presentation. We will have time for Q&A at the end. Now, I'd like to introduce Mark Montenegro. Mark is a USC architecture alumnus, Guild board member, and creative director of architecture and partner at Rios. Please welcome Mark, who will reveal this year's challenge. Mark.
Good morning. Welcome to everyone. Very excited to be here. And this year's Charrette Challenge brief will be called Catalytic Community Space. I'd like to start off by first letting you all know that the Guild's Charrette goal this year has been to try to open up the design Charrette to all disciplines and make a more inclusive project to work on. And by doing so, we hope to see solutions that innovate around all of the ideas of design that exist within the USC School of Architecture, including architecture, landscape architecture, building science, and historic resources, as well as landscape architecture. The proposed solution can look to various typologies. It is not a typology-based charrette. We would like to see spaces that reflect the communities in which they are meant to serve. It can be public open space driven, adaptive reuse of an existing building or historic building. It could be a ground up or modular building. It could be something that thinks about its site, the disciplines you feel are most important in driving design, and a strong concept. This is an ideas competition and is meant to look at two goals. The first is to find the poetic of our current time by designing a facility that initially serves as a community-based temporary healthcare pop-up to provide access to COVID-19 testing and vaccination, all things that we should be quite aware of at this point, 2 years in. But more importantly, the second goal of this charrette is to design this pop-up with the ultimate goal of building a facility or landscape that can be repurposed into a community amenity in the post-COVID world to serve the neighborhood in which it exists. Teams can determine the program and the function of the final amenity for the community based on what you determine is needed or something that might augment the community in a positive way once you determine your site. Given this brief, each team is to use their personal experiences in dealing with COVID-19 and the pandemic, which is really important to insert yourself into this and not make assumptions outside, because I think this has been a very personal experience. And then you should think about how you catapult this and think beyond our current situation to find opportunities in really investigating what tomorrow looks like. The fundamental purpose of this brief is to demonstrate how COVID-19 has affected and impacted how we think about space. Simultaneously, taking that idea of social distancing, queuing, anticipation, fear, and its need for communication, openness, equality, inclusion, and then turn it on its head at the end by imagining how these same values, these same criterias for creating something that is of our time can be changed into something positive to the future and looking towards the future. Each team should set forth a design that looks towards innovation. You should look towards innovating around whether this could be handled in an open space setting, a pocket park, all the way through to a rehabilitation of an historic storefront or historic theater. You can think outside the box. You can tear down and create an open lot to bring in modular pieces that can be replicated. We are looking for you to inspire us in finding new solutions and bringing each of your individual disciplinary studies and ideas to the table. So as part of this, we've also isolated issues that we would like you to address as part of this. So it's the short-term function and the eventual reuse of the project design, the issue of whether design is repeatable or site-specific. We'd actually like you to try and tell us which one you believe in and which one your design is addressing. Any sustainable features in thinking about carbon, embodied carbon, all the way through sustainable systems. We'd like you to elevate the experience of the program. Think about what it's like, what you went through to get tested daily, to get vaccinated, to get your booster, to wait, to experience anxiety, as well as maybe even relief once you have gone through, and bring this experience to your thinking. Cultivate the graphic submission to tell the story clearly. We are looking for you to articulate your idea and your concept in the most succinct way. And so part of this is your presentation. We will be looking at the quality of the graphic representation as well as the quality of the idea. We've given you a set of values just to give you a center. These values are to be embodied by your project, and we're looking for social responsibility, equity and inclusion, joy and optimism, wellness. We're looking for design innovation. We're looking to see how you take this idea of the brief and you interpret it and you innovate around it to show us how space is not singular. Response and solution is not singular. It is how we put things together, how we conceptualize, and then how we ideate around that matters. We're looking for diversity, equity, and inclusion. We're looking to see how you take this program and you make it accessible to everyone. You look at how the context and how communities that are underserved might be better served through rethinking of space, communication of information, as well as being welcoming as a design and being appropriate as a design to its context or to its function. And lastly, safety and security. As with everything, understanding how this will operate and how this fits into a community and what it says is really important. Site selection. We are going to leave that open to you. We would like you to propose a community that is underserved in the Los Angeles County area and work by defining what you want us to look at, whether it's a historic building within an urban context or a park that already exists in an urban context, or a historic structure, a historic place. We will leave that to you. The board feels like some examples of what type of areas one could choose, you could choose, are such places as MacArthur Park, Limerick Park Village, or the sort of rural area of Palmdale Town Center. And again, what we are looking for is projects that place themselves within underserved communities, because we're looking at the access to testing and vaccination currently, but then also the transformation into that space, into a community serving place. The project itself needs to be a minimum size of 7,000 square feet. It can be larger, and it can be much more integrated into the community, into its context than that size, but that is the minimum. The program minimum areas we have listed, I'm not going to go through, but you can see is fairly minimal and is really just to give you a baseline. You can add to it, you can change it and challenge it if you want, but we're going to look to you to define and tell us why you went another way. The recommended schedule, this is a 5-day schedule. We wanted to make sure you all understood how we were thinking about it, so that we gave you a recommended schedule. First day we were thinking is site selection and analysis of the site. If you spend more than a day on trying to select a site, I think you're in trouble. So get to it, don't overthink it, and pick somewhere that you feel is appropriate and start to think about its setting and how your approach will deal with it. Get to the meat of the bones within a day. Day 2, we are imagining you're already massing, you're thinking about fit, you're thinking about conceptualization of an idea with your teammates, and by days 3 through 5, you're in some sort of production mode of trying to develop the design and get towards the presentation boards and submittal. For our submission requirements, you are to pay attention to the deadline. We will not accept any entries after the 5 o'clock deadline on Saturday, I think. And it's very important because they will be time-stamped. I would recommend that you test accessing the site sooner, just so that you all have verified you have experience at getting onto the uploading site. We would like you to have all of the requirements of the minimum presentation to fit onto 10 pages maximum in a PDF no bigger than 10 megabytes. Along with this file, we are requesting a maximum 3-minute video, maximum, shorter the better, video pitch. We'd like you as a team to tell us what your concept is and why you looked at it in that way. It doesn't need to go over every facet of the project. We've got your PDF. We're looking for the why. We're looking for you to tell us the big picture very quickly. Remember, more words is not always better. Next, submission scoring. We will be looking at 5 general categories and scoring them with a total of 100 points possible. Design will count for 20 points. This will be vision, your overall concept and translation of that concept into a clear project. Site will be another 20 points. The selection and how you handle its relationship to the context, or through an idea of repeating and spreading and trying to understand a global system for the county, will be another category. Programmatic clarity of the vision will be the third for 20 points. And we will be looking at understanding how you envision the pop-up of the COVID-19 testing and vaccination space transforming. And we were looking for that clarity of how you programmatically transform to a community-facing amenity. And fourth is interdisciplinary work. We're looking to see how you mix the design disciplines between architecture, landscape architecture, historic, and building science, right? We're really trying to see how you guys expand the field of design. And lastly, quality of presentation and representation. We're looking to understand how you tell the right story of your concept. We're looking for you to tell us about the buildings and spaces you're designing through the drawings you will be making and the rendering we are requesting. We provided you with a series of links to different publicly accessible information sites for developing models or information about different places within the county. We look forward to seeing what you provide to us and be completely blown away. So thank you very much.
Thank you, Mark. So to help us help inspire ideas and solutions to this design challenge is Dr. Sarah Van Orman. Dr. Van Orman received her BA from Carleton College, her MD from Mayo Medical School, and her MMM, which I believe is Masters of Medical something.
Management.
Sorry. Management, that's it. I looked it up and then I forgot. From Carnegie Mellon University. She completed her residency training at the University of Chicago Hospital and Clinics. Please welcome Dr. Sarah Van Orman, USC's Associate Vice Provost for Student Health, Chief Health Officer, USC Student Health, and Clinical Professor of Family Medicine Division Head College Health. Welcome, Dr. Van Orman.
Great. So thank you. Good morning. And thank you for letting me join you this morning. What an exciting project. I'm really excited to see what comes out of it because we've spent the last 2 years of our lives living in pop-ups. So I'm going to share with you a little bit of our experience here at USC. Again, not to tell you kind of what I know create will be much more exciting and inspiring. But I hope some of the information I can share about what we've done here provides you just a place to start or start to think about. So I'm going to try to share my screen here. And we will go from there. Let me just quickly do this. Share. Okay, all right, can you see my screen okay? Excellent. Okay, so I'm going to talk a little bit about our experience about pop-ups at USC. Before I get started, I just wanted to provide a little bit of context for people as they're starting to think about the notion of pop-ups, is that the idea of a pop-up is not new in infection control, pandemic preparedness, and just as part of medical emergency planning. I put a link here to an old document on the US CDC website, which talks about what are called a pod, which is what we used to call these. So we know that for many communicable disease emergencies, there needs to be what we call medical countermeasures, whether that's vaccines, chemicals, antiviral drugs, antibiotics, testing, that might need to be distributed quickly. And so prior to this pandemic, most counties, most states, most federal governments, many private agencies had what we call pod plans. What are a point of dispensing, which is really what these pop-ups are. And they're really community locations that would be used in the event of an emergency to dispense these medical countermeasures. And so if you thinking about these, this is where the pop-ups come from. They're not something new. They're something that have been in people's planning. But the duration and the length of the COVID-19 pandemic has really changed the number, and for many of us, given us our really first experience with running a pod. So I think one thing to think about is just to ground it in the notion that these pods are nothing new, but they maybe have been thought about differently over the duration of the COVID-19 pandemic. Why do we have pods, or why did we have these pop-ups? So, we know that traditional healthcare delivery facilities simply cannot meet the capacity for mass testing and vaccine distribution. That's why pods exist. The other thing that's interesting about pods, and even in the beginning stages of the COVID-19 pandemic, is that rather than operated by traditional healthcare organizations, these were often operated by governmental agencies with or without cooperative agreements with the private sector. So they have a different kind of relationship, and many times they have a complex relationship to both government as well as the healthcare sector. The other thing that really drove us during the SARS-CoV-2 response was that we couldn't be inside, that when people had to be 6 feet apart, and when you take your mask off, you generate aerosols that potentially can infect others. And so when we think about all the planning, this was critical as a fundamental condition we had to meet, that if we had people outside, we didn't have to worry so much about people infecting each other. And then importantly, and I saw this really woven into the brief that was just reviewed, is that these types of distributed distribution really has the ability to reach all people. We want every impacted population to make use of testing and vaccine facilities. And we know that how we have these facilities, where we have these facilities, so much about these facilities can impact people's ability to be able to, or to choose to take part and to either be vaccinated or be tested. So a little bit at USC, we've now, over 2 years ago, we issued our first health advisory about what was then the novel coronavirus. We actually started, and March 16th was our first day of COVID testing at USC. At peak volume, we've done up to 10,000 COVID tests a day. In July of that year, the Trojan check launched, where we started checking the perimeter. And then in January of 2021, we actually started providing vaccinations for our faculty, staff, and students. Initially, it was just our older faculty and our healthcare workers. We've provided about 100,000 vaccines on the USC campus, the University Park campus alone. That doesn't count the medical center. And at the peak, we were able to provide about 2,000 vaccines on campus. We're about 95% vaccinated now, and we believe as of Monday, we actually passed our 1 million COVID tests. So we've actually provided 1 million COVID tests on the UPC campus and the HSC campus over the course of the past 2 years. We have operated 12, I actually forgot one, 13 pop-up sites over the course of the pandemic. It's unbelievable, 8 of which are still operational. So we have 3 sites for vaccination, one of which is now closed. I forgot about a site. We actually had 7 sites for testing, 4 of which are still operational, 2 antigen testing sites, 1 that's now operational, and 1 patient care site on the Engelman Plaza. And I know many of you have maybe visited these sites, but we've operated many sites with many different reasons, and I'll talk about some of the considerations we have, and then I'll share some photos of a few of the sites and just some of the things that happened or some of our thoughts. I will say that we maybe weren't as creative and as exciting as designing the sites as I know you all will be, but we got pretty good at doing this over the course of 2 years. This is a really long list of the things that we consider, and I'm happy to share these slides with the group, and I won't go through all of these in detail, but when we think about setting up a site and running a site, there's so many things that come into consideration, safety and security for both the staff as well as the patients. I already touched a little bit on infection control, the fact that we have to take people's masks off and make them cough and sneeze, which really creates risk. Communications, what are we telling people by the sites itself, both kind of how do you get in and out of the site, the really basic logistics, but also do the sites reinforce our other public health messaging that we want to get out to people, right? Do they leave the site feeling more engaged about protecting themselves and others than when they're there. Obviously, IT is a huge issue. I'll talk about some of our environmental challenges: heat, cold, air quality, ground quality. Crowd management, as I mentioned, we tested up to 10,000 a day and vaccination at 2,000 a day. And then the COVID vaccine had a 15-minute waiting period where you had to watch people, which was very unique. There's materials management, security, refrigeration, storage. Equity is very important. Understanding, are we getting providing it where people are, and if we see a population that's not able to have as much uptake of the service, are we making specific efforts to put those facilities in those locations that serve those individuals? Competing uses for the space, transportation, and then accessibility, particularly for individuals that might have mobility, sight, or other kinds of accessibility issues. So this was on the left-hand side of the slide is our first planning meeting in the Ingeman Plaza for our pop-up tent. And one of the things you'll notice about this is that nobody's wearing a mask. This was in early March of 2020, before we began universal masking, but that's the team meeting to think about how are we going to do this. And on the right is our very first testing in the Ingeman Plaza in March of 2020, where we had set up what we thought would be a space to test 15 or 20 people a day. Over time, the testing evolved and became the POP testing. And many of you I know have visited the Jefferson Parking Garage POP testing site, along with that's our main site, along with the Party Lawn site. I'll make a note about POP testing. So we branded it POP testing sometime in the summer of 2020. We thought it was a good name for pop-up, and many of you now, everybody refers to it as pop testing. So it's really interesting how that name kind of stuck along with the popcorn logo. We actually have mixed feelings about the branding now, because some people think it's like not real testing. Like they're like, is it real testing? Is it PCR testing? Or is it something like just pop testing? Yes, it is PCR testing. It was just the brand that we chose at the time. And so it's very interesting how that brand has become something on campus now. So that's our POP testing locations. Party Lawn has been a major one, and I just thought I'd share with you, it's when you have an outdoor site or a remote site, lots of issues. Our first Party Lawn site, it rained and everybody sunk into the grass. So we had huge issues working with facilities about the unstable ground conditions. The fall of 2020 was very challenging because we had wildfires and trying to manage the air quality. And then our testing site at the lab actually continued to close down because it was a location for a lot of, during the summer of 2020, with some of the civil disobedience, which is great to see. We had to close the lab and also we had continued safety and security issues at the lab testing site because it was right off of Figueroa. Our vaccine sites, this is our first vaccine site on the ground floor of the Lion Center. You can see the treadmills there in the back. That's where we first operated. Interestingly, at the vaccine sites in January 2021, we actually had security officers outside, because at that point there was everybody wanted to have the vaccine, and we had security concerns of people kind of coming that weren't. Unfortunately, we had to follow strict eligibility from the state. And so we actually were concerned about people coming who weren't yet eligible. And it was a really difficult time at that moment because we had people coming and begging for the vaccine. And it was really a poignant moment when we were able to deliver those first vaccines, but also challenging because we had to turn people away. We were able to open up that vaccine site for a brief period in February and March when we actually had extra capacity, and we actually invited neighbors from the UPC neighborhood to come in. And it was an overwhelming response. People were so thrilled, and they wanted to come to USC to get their vaccine. They weren't USC faculty, staff, or students, but they said, we trust USC. We know that USC brand meant something to them as a reliable and credible place to come be vaccinated. And so that was a really special moment where we were able to provide those vaccines to community members that otherwise wasn't sites. Now you can get a vaccine everywhere, but that was not the case. But we had to close this site because this is where we get to competing uses where students wanted to get on those treadmills. So we actually now have 2 vaccine sites. We have one in King Hall and then the second floor of the Lions Center. The Lions Center site has been up now for almost a year. It's going to be closing next week. It's an interesting moment in the pandemic where we're going to close down that huge vaccine site, but we were doing 2,000 or 3,000 vaccines up there a day. And now we're up in King Hall where we're going to be doing our next vaccine site. So those are just a quick snapshots, just to summarize. I don't want to take too much time, but these temporary facilities were a critical part of our response here at USC and within LA. The duration of the pandemic was a really unique challenge, right? Because most pod sites are designed to operate for 4 to 6 weeks through the duration of an emergency plan. No one imagined we would still be running 8 pop-up sites 2 years later. But I think woven into this is that, temporary facilities are unique. They have an opportunity not only to get the services out, but they really are critical. Where we put them and how we run them really address access and equity issues, both now and into the future. So I think that some of us in healthcare have reflected that, the fact that we were able to vaccinate 80% of the Los Angeles population in parking garages and Dodger Stadium, it really makes us think about how we deliver healthcare services in general, right? And when we drop the barriers, we go to the communities, we use non-traditional methods. There are really opportunities to deliver healthcare services that our existing healthcare infrastructure and facilities maybe make challenging. So I think that's where the opportunity lies. I'm excited to see what people come up with. So I'm going to stop there, and hopefully that was interesting and provides a little bit of context for the work you're about to engage in.
Thank you, Dr. Van Orman. I am sure that this presentation will be very helpful to the teams as they embark on this design idea. I found it very insightful. And we're honored to have you, so thank you. So before we move into Q&A, I just want to make 2 critical points. One, all teams reminding you that you must participate in the mandatory mentoring session tomorrow evening, I believe, and you all should have an invite. So that is mandatory. The other thing is that the flyer that you receive will have an email to Keiko. And so you can still submit questions after this session through that email. And so now for Q&A, you can submit your questions in the chat, or if you're bold enough, you can just raise your hand and speak.
Excuse me?
Yes, hi, Keiko.
Hi. I was wondering, first of all, is the brief going to be available to us afterwards? Like, you'll send us the brief?
We are actually, thank you for reminding me. Cynthia, are you going to put it in the chat?
We are going, yes, we're actually going to put the brief directly in this chat as soon as we're finished. You will get an email from us shortly, which will have like a reminder for mentor session, the final award ceremony with the brief and any like last minute details. But because it's still being prepped, we're going to put it directly in the chat as soon as we leave. So make sure you stay for that.
Thank you.
Other questions? I don't see anything in the chat.
It looks like there's a hand up.
Oh, I gotta watch hands now. Okay. Whoever has your hand up, because I don't see you, go ahead and ask the question, please.
Hi, I have a few questions. Oh, sorry.
Go ahead. I can go next.
Okay, I have a couple questions about the brief. I think I saw at 2 points that the pitch video was either 3 minutes or 10 minutes.
Oh, it's 3 minutes max.
3 minutes. Okay. And then also, when is the deadline? Because the brief said 5 p.m., but other places I've seen midnight, or is that just to allow for the upload process?
5 p.m. on the 19th.
Okay. And then last, do all members need to be present for the mentoring session or just a representative from the team?
That's a good question. I would say that all team members.
Okay, thank you.
Mark, I don't know that we went into that detail, but I think we assumed and expected all team members.
I agree with you. Yes.
Hi, I have a question about, so our final presentation would be totally visual on Zoom rather than in person, right?
That is correct.
Both components. You've got the 10-page maximum PDF, and then you've got your 3-minute pitch video.
Pitch video, okay. And the video time length, I guess, would be included in the 10 minutes presentation, right? Which means we have 7 minutes for the verbal part to show our PDF.
Let us come back to that in 1 second. Let me look for the discrepancy in the brief.
There was a question.
Cynthia, there's one question. This is B about recording of this meeting. Will the teams have access to it?
Yes, we can share this recording afterwards as well when that email goes out.
Perfect.
Another question is the mentor session assigned, or do we need to use our current mentor? Chris, I think they're assigned, is that correct?
Yeah, we're assigning mentors. Some groups will have one, some groups might have two.
Okay, and Chris, will you make sure there's another comment that someone did not receive an email for the mentoring session?
I sent the ones out to the mentors, and I think the school is sending the ones out to the students that are participating.
Okay.
Yeah, I think that, sorry, I'm going to go back to the submittal. I think there's a discrepancy. The 10 minutes is incorrect. 3-minute video pitch with your 10-page submittal that's it for the submittal. There will be no presentation for each of the groups. You will be initially evaluated on those 2 submittal pieces. When we short list, I believe there may be a chance for that, but there are no live presentations required for the initial.
Thanks.
Is the presentation audio only, or do you want to have maybe visuals throughout?
Sorry, I can't hear your question.
You could do both. You could use in your 3-minute pitch, if you want to use a diagram or flash sheet, those 3 minutes are yours. You can do however you feel like you can communicate the clearest.
There is a question, if we have class tomorrow till 8:20, maybe join a bit late to the mentoring session. Of course. Just let your team members know so that you can get the benefit of their participation and they can follow up with you. But join as soon as you can.
Yeah, just to follow up on that, if we have class from 6 to 8:20 and we're completely missing that mentor session, is there a possibility to also meet maybe like the next day or just another time?
There's no limit, and correct me if I'm wrong, team. There's no limit to how often you can meet with your mentors, if your mentors are available. I would also, and I don't know if the mentoring sessions are going to be recorded. So perhaps we can clarify that as well, to give those team members who have class.
I had a question for Sarah Van Orman, if she's still in the meeting.
Yes.
I was wondering, in your process for dealing with student health at large, because I think that your official title is under first, all of student health, right?
Yeah.
Did you find that, I don't know, COVID testing and COVID vaccination ever eclipsed other important facets of student health, and in which ways, and how did you kind of combat that over the last 2 years?
Oh, that's a complex question. Absolutely. I think every healthcare system, including ours in the country, was really challenged. absolutely. I mean, we added lots of staff, but absolutely. I mean, you know, right. Healthcare workers are exhausted and burnt out, and you know, COVID is our work. But you know, we also did all the contact tracing for the university. And so it's a I think when you think about this design competition and those questions, right? So thinking about what's it also like for, and maybe I'm not totally answering your question, but what's it like for those people working in those facilities, right? This is not where we normally work. And you know, it's got unique challenges for the people that are there as well. And the facilities that are running them, right, they're stretched thin, right, because they have to run their normal things. And there's really good evidence that, you know, delayed services, you know, across the country, whether that's in student health or elder populations, people didn't get other services because of the need to do, whether that was the facility going offline or the staff going offline, to both care for patients with COVID as well as do the testing and vaccination. So it's kind of a long answer, but it absolutely has been the challenge in healthcare right now. A lot of the focus is on the people that are in the hospital, and what that does to the healthcare delivery system, but all the rest of this also has impacted the healthcare delivery system. I don't know, Jacob, if that answered your question.
Yeah, I mean, I'm not an expert on it at all, but it's super interesting to hear you talk about it, because I think that part of it has been, you know, hard for us to judge as students or as people going by, but that's great information. Thank you.
Yeah.
Any other questions? I think the ones about the mentor are answered in the chat.
Gabrielle, just about the mentors, because somebody was asking if they could arrange a separate meeting. And I know last year they, when we went on to the mentorship sessions, if not everybody could make it, or there was some kind of a scheduling issue, they arranged on that day with their mentor to see if they could get another appointment directly with them, and they created their own Zoom meeting or what have you. So there was the possibility, if the mentor is willing to have a separate meeting, they can do that if there's scheduling conflicts with their school. But we should have somebody there at the initial mentorship.
Great. Okay. Anybody else? Everybody's ready? Going once? One more question. Jacob, you have something?
Yeah, I just, sorry.
Okay.
I wondered also if this is also for Sarah Van Arman or anyone who maybe wants to jump in, but I wondered if you think that testing sites are an opportunity to inform people better or sort of educate people, because I know that there's a lot of vaccine misinformation, but also just a lot of disclarity over, you know, what is a PCR test versus an antigen test? What does it mean to have antibodies for the vaccine, but to test positive, you know, things like that. And I know that for lots of other diseases as well, they tend to sort of have the social stigma and the sort of social information that may not be accurate to the information. So I wondered whether you think, or whether it's the time and place to educate people on those things in like a testing facility, or if there's not really time for that, or if it's kind of more, you know, more strict and controlled. Like, I don't know, what are your thoughts?
Yeah, you know, it's a great thought. I absolutely think that public health communications is a great part of your facilities. It is a balance, though, and I would say that when you think about health communications, you need to do it thoughtfully, right? Because it looks different based on the community you're engaging with. So a process to understand who's the best educator for that community, what's the best education delivery system for the community. So if you're designing, I would say if you're designing a facility, right, and you want to include public health information or education or communication as a piece of it, you know, how do you create a process to engage the community into understanding what's the best way to deliver that? Because I think your first reaction is to like, I'm going to put up an educator in the front and slap up some posters and, you know, and that might be the right strategy, but you can also, you know, if it's the wrong tactic, you can also alienate people, or you can make them feel uncomfortable, or you can actually keep people from going. So I absolutely believe it. I think it's a great idea, but thinking about how do you do it in a way that's appropriate for the community and engages the community and is the right way to deliver that information. When people are sick, you know, for example, they don't want you to tell them how to not get COVID. But it's really unique and I think exciting challenge.
I would love to just throw out there as well that part of the programmatic brief does require you to think about communicating to the community you want to go into, and the different languages and the different types of communities within a neighborhood. That is a very important part of inclusivity, is being able to communicate in the terms of other languages and multiplicity. So I think it applies across more than just the healthcare part of this, is also about engagement.
Thank you. Yeah, definitely. Maybe just while I'm talking briefly, I wondered for the Guild, the format of the jury, will there be a sort of conversation like there was last year where a few teams would able to speak to the jurors, or is it going to be more of a sort of conversation about the projects and then kind of like the crowning?
Who wants to answer that? If I recall correctly, the shortlisted teams will have an opportunity for Q&A. Is that right, team members?
That's what I recall.
Landed. Yeah.
So we'll have the top 6 teams for the grand prize kind of notified before the award ceremonies. Those top 6 teams will have a chance to, one, give their mini presentation and ask questions live. And then afterwards will be awards for both that grand prize as well as the 5 or 6 underneath it.
There is a question on whether the pop-up we are designing will be temporary or permanent, and will we have any material restrictions? The idea is that while the testing requirements are today, but what's the post-COVID world? What's the reuse of said pop-up? So yes, it is a temporary use, but hopefully it could be a permanent reuse in a different manner, if that answers your question. I don't think we haven't cited any material restrictions. Is Palmdale Town Center in Palmdale? I believe so. Mark?
Yes, it is. It's by the post office.
We got that one right. Any other questions? And the brief has been put in the chat, so you can get that. Anything else? More questions? Hands I don't see. Okay. Well, thank you for participating, and we're looking forward to all of your innovative designs. So good luck and bye now.